Japan has the highest percentage of people over 80 who still walk without assistance of any country on Earth. And when researchers started looking at what separates them from aging populations in other countries, one thing kept showing up in rural communities, especially in Okinawa and parts of Tohoku: a simple morning practice involving fresh ginger applied directly to the knees. Not a supplement, not a prescription. A root they buy at the market for almost nothing. Now, before you write that off, understand something. What's happening under the skin when you do this is actually well documented in pharmacology. There are measurable mechanisms. And once you understand them, this stops sounding like folk medicine and starts sounding like surprisingly smart physiology. Let's talk about what's actually going on. Your knee joint is one of the most mechanically complex joints in your body. It bears your full body weight with every step, absorbs shock, rotates slightly, and does all of this across decades of use. The tissue inside, cartilage, synovial membrane, bursa, doesn't have its own blood supply the way muscle does. It relies on fluid movement and compression to stay nourished. That's part of why it's so vulnerable to wear and why inflammation there tends to linger. When that joint becomes inflamed, whether from osteoarthritis, repetitive stress, or age-related degeneration, the body sends out compounds called prostaglandins and cytokines. These are the chemical signals that trigger pain and swelling. Your nerve endings pick them up, and that's what you feel as stiffness, aching, or that grinding sensation when you go downstairs. Most people reach for ibuprofen at that point, and ibuprofen works by blocking the enzyme that produces those prostaglandins. It's called COX2. That's the entire mechanism, COX2 inhibition. Here's what most people don't know. Gingerol, the active compound in fresh ginger, inhibits the same enzyme. Multiple peer-reviewed studies, including one published in Osteoarthritis and Cartilage, have confirmed this. The mechanism is not a guess. It's been measured in tissue samples, in clinical trials, and in population studies. Ginger acts on COX2 and also on another inflammatory pathway called 5-LOX, which ibuprofen doesn't even touch. So when these communities apply ginger topically every morning, they're not performing a ritual. They're delivering an anti-inflammatory compound directly to inflamed tissue. Now, why topical? Why not just eat it? Well, that's a fair question, and the answer matters. When you eat ginger, it goes through digestion, enters the bloodstream, and gets distributed throughout the body. It works systemically. But when you apply it directly to the skin over a joint, you create what pharmacists call a concentration gradient. The compound moves from an area of high concentration into deeper tissue layers, including muscle, fascia, and the joint capsule below. Studies using transcutaneous absorption models have shown that gingerol does penetrate past the skin barrier when applied with warmth or carrier oils. The Japanese practice, done in the morning when the body is warm from sleep, takes advantage of exactly this. There's also a secondary mechanism worth understanding. Ginger applied to the skin causes mild vasodilation. It widens the small blood vessels near the surface. That increases local circulation. And for a joint that depends on blood flow to clear inflammatory byproducts and deliver nutrients, that circulation increase isn't minor. It's part of why people notice the effect within 20 to 30 minutes rather than hours. The morning timing isn't random either. Joint stiffness is typically worst in the first hour after waking. That's partly because synovial fluid, the lubricating fluid inside the joint, doesn't circulate much during sleep. The joint sits compressed, fluid redistributes, and when you first start moving, the cartilage surfaces are less cushioned than they'll be later in the day. Applying ginger at that window targets the period when inflammation and stiffness are already at their peak. There's one more layer to this that most people overlook. Chronic knee pain doesn't just damage joints, it changes how you move. When something hurts, your nervous system compensates. You shift weight, you shorten your stride, you stop bending fully. Over months and years, those compensations become patterns, and they put abnormal stress on other structures: the hip, the lower back, even the opposite knee. People who manage morning stiffness effectively tend to move more naturally throughout the day. And movement, done correctly, is one of the most powerful things you can do for joint health over the long term. Not rest, movement. That's part of what makes this practice interesting from a clinical standpoint. It's not just about the compound. It's about staying functional enough to keep moving, which slows the degeneration cycle. Now let's be clear about what ginger can and cannot do. If you have severe osteoarthritis with significant cartilage loss, topical ginger is not going to rebuild that tissue. Cartilage doesn't regenerate in adults. What ginger can do is reduce the inflammatory load on the joint, which reduces pain and swelling, which allows better range of motion, which slows further damage. It's supportive. It's not a cure. It also won't replace proper treatment for conditions like rheumatoid arthritis, gout, or septic arthritis. Those require specific medical management. If you have knee pain that came on suddenly, is accompanied by fever, or involves significant swelling with warmth and redness, that needs a clinical evaluation, not a home remedy. But for the far more common presentation, the gradual stiffness that comes with age, the ache after activity, the morning rigidity that takes time to work through, this is a physiologically sound approach with a real evidence base. Here's how to apply it correctly, because the preparation matters. You want fresh ginger root, not powdered, not dried. The gingerol content is significantly higher in fresh root, and it's the gingerol that's doing the work. Powdered ginger contains mostly shogaol, a related but less potent compound. Grate or finely crush about a teaspoon of fresh ginger. You can mix it with a small amount of a carrier oil. Coconut oil works well because it melts at skin temperature and helps with absorption. Some people use sesame oil, which is traditional in parts of Asia and has mild anti-inflammatory properties of its own. Apply the mixture over the kneecap and along both sides of the joint, where the synovial tissue is closest to the surface. Massage it in gently for 2 to 3 minutes using circular movements. This isn't just about absorption. The mechanical action of massage itself stimulates synovial fluid production and improves local circulation. Leave it on for 20 to 30 minutes before washing off. Some people cover it lightly with a cloth to trap warmth. Do this before you start moving much. Before breakfast, before your morning walk, while your body is still in that quiet, warm state from sleep. A few practical notes. Ginger will cause a mild warming or tingling sensation. That's normal and expected. It's the same compound that makes ginger spicy to eat. What you don't want is a burning sensation that intensifies or skin irritation that develops after repeated use. A small percentage of people are sensitive to topical ginger. If you notice any redness, itching, or irritation, discontinue use. Also, ginger has mild blood-thinning properties. If you're on anticoagulant medications like warfarin, or if you're using other anti-inflammatory drugs regularly, mention any new supplement or topical approach to your physician. The topical absorption is lower than oral dosing, but it's not zero. What about consistency? This is where the evidence lines up with what these communities actually do. They don't apply ginger once and evaluate it. They do it every morning for weeks and months. The anti-inflammatory benefit is cumulative. Joint inflammation is a chronic process, and managing it is a chronic practice. A single application gives you a window of reduced pain and improved circulation. Regular application over time reduces the baseline inflammatory state in the joint. One clinical study followed knee osteoarthritis patients who used a topical ginger preparation twice daily for 6 weeks. At the end of the trial, patients reported a statistically significant reduction in pain and stiffness compared to the control group. That's 6 weeks of consistent use, not 6 days. The broader lesson from how these Japanese communities approach joint health is actually worth reflecting on. They don't treat pain as something to mask when it becomes unbearable. They manage inflammation continuously, with food, with movement, with small daily practices. Ginger shows up in their cooking too. Soups, pickled preparations, teas. They're not just applying it to their knees. They're consuming anti-inflammatory compounds from multiple directions every day. That kind of layered, consistent approach is very different from how most people in Western countries handle joint health, which tends to be reactive. Wait until it hurts, take something strong, repeat. The physiology of cartilage and synovial tissue responds better to consistent, moderate management than to occasional aggressive intervention. That's not a cultural opinion, that's just how the tissue works. If your knees have been a problem, morning stiffness, aching after walking, discomfort climbing stairs, this is something concrete and low risk you can add to your morning. It costs almost nothing. It has a real mechanism. It has clinical support. And it fits into 5 minutes before you eat breakfast. It won't undo years of damage. But it can meaningfully reduce daily inflammation, and that reduction compounds over time into better mobility, less pain, and a slower rate of joint deterioration. That's what those communities understand intuitively, and what the pharmacology now confirms. Simple, consistent, and grounded in how the body actually works. And there you have it. Take this knowledge and take control of your health. Thank you for watching.